Do you know that men are much more likely than women to ignore health problems and avoid going to the doctor? That's right, guys, you might be putting your health at risk by brushing off those signs that something is wrong. We may think that they are just minor issues or that they will go away on their own. But what if they don't? What if they are warning signs of something more serious, like cancer, heart disease, or diabetes? In this video, we will reveal 14 health symptoms that you should never ignore and what they could mean for your health. Believe me, some of these symptoms will truly surprise you. From skin changes, frequent urination, constant fatigue, to persistent cough. Watch until the end to learn about all of them. So, without further ado, let's get started. Number 1. Frequent heartburn. Do you often feel a burning sensation in your chest or throat after eating? Do you have trouble swallowing, nausea, vomiting, or a sour taste in your mouth? These could be signs of gastroesophageal reflux disease, or GERD, which is a condition that affects about 20% of adults. GERD occurs when the acid from your stomach flows back into your esophagus, which is the tube that connects your mouth to your stomach. This can damage the lining of your esophagus and cause inflammation, ulcers, bleeding, or even cancer. The main cause of GERD is a weak or malfunctioning lower esophageal sphincter, LES, which is the muscle that acts as a valve between your esophagus and stomach. GERD is usually treated by avoiding the foods and habits that worsen your symptoms, eating smaller and more frequent meals, elevating your head when sleeping, and taking over-the-counter or prescription medications that reduce or block acid production. Number 2. Bloody or black stools. This is not a pleasant topic, but it's one that you shouldn't ignore. If your stool is black and tarry, it could be a sign of upper gastrointestinal bleeding, which is a medical emergency. Upper gastrointestinal bleeding occurs when there is a rupture or erosion in the lining of your esophagus or stomach. On the other hand, if you notice blood in your stool or on the toilet paper, it could be a sign of hemorrhoids, which are swollen veins in your anus or lower rectum. These are very common and can be caused by straining during bowel movements or sitting for long periods of time, obesity, or a low-fiber diet. Hemorrhoids can be painful, itchy, and uncomfortable, but they are usually not serious and can be treated with over-the-counter creams, suppositories, or pads. However, if bleeding persists or becomes severe, you should see a doctor who can rule out other causes of rectal bleeding, such as anal fissures, diverticulitis, ulcerative colitis, Crohn's disease, or colorectal cancer. Number 3. Lump or swelling in the testicles. Do you feel a painless lump or swelling in one or both of your testicles? Do you have a feeling of heaviness or discomfort in your scrotum? These could be symptoms of testicular cancer, a rare but highly treatable type of cancer that affects mostly young and middle-aged men. Testicular cancer occurs when abnormal cells grow in one or both of the testicles. The exact cause of testicular cancer is unknown, but some risk factors include undescended testicles, family history, infertility, HIV infection, or exposure to certain chemicals or radiation. The best way to prevent testicular cancer is to perform a self-exam once a month, preferably after a warm shower when the scrotum is relaxed. You should gently feel each testicle for any lumps, swellings, or changes. If you find anything unusual, you should see a urologist as soon as possible. Number 4. Skin changes. Do you have new moles on your skin? Did an old mole change color, shape, or size? Maybe there's a mole with an irregular border. All these could be signs of skin cancer, the most common type of cancer among men. Skin cancer can be caused by exposure to UV rays from the sun or tanning beds without sunscreen, as well as genetic factors or immune system problems. The good news is that skin cancer can be cured if detected early, so you should check your skin regularly and see a dermatologist if you notice any changes or new growths. You should also protect your skin from the sun by wearing sunscreen, hats, sunglasses, and clothing that covers your skin. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Number 5. Excessive snoring. Is your own snoring waking you or your partner up at night? That could be a sign of obstructive sleep apnea syndrome, which is a condition that affects about 25% of men. Sleep apnea occurs when your airway becomes blocked during sleep, causing you to stop breathing for short periods of time. This can disrupt your sleep quality and lead to daytime fatigue, headaches, mood swings, and poor concentration. More importantly, sleep apnea can increase your risk of high blood pressure, irregular heartbeat, heart attack, and stroke. If sleeping on your side or stomach doesn't help, then you should see a sleep specialist who can diagnose and treat your condition. You may need to use a CPAP machine, which is a device that delivers continuous air pressure to your airway, or a dental appliance that changes the position of your jaw and tongue at night. Number 6. Frequent urination. Do you find yourself running to the bathroom more often than usual? Do you wake up in the middle of the night with a strong urge to pee? If so, you may have a condition called nocturia, which is defined as having to urinate at least twice per night. All these symptoms could be a sign of diabetes. When you have diabetes, your blood glucose levels are too high, which makes your kidneys work harder to filter it out. As a result, you produce more urine and feel thirsty more often. Frequent urination can also be a symptom of benign prostatic hyperplasia, BPH, which is a condition that affects about 50% of men over 50. BPH occurs when your prostate enlarges and presses on your urethra, the tube that carries urine from your bladder when you urinate. This can cause frequent urination, weak or interrupted flow, or trouble starting or stopping your urine stream. Number 7. Persistent cough. Do you have a cough that lasts longer than 3 weeks? Do you cough up phlegm, blood, or pus? Do you also have chest pain, wheezing, shortness of breath, or fever? These are symptoms of many serious respiratory conditions. For example, persistent cough could be a sign of pneumonia, which is an infection that inflames the air sacs in your lungs and fills them with fluid or pus. Persistent cough could also be a sign of chronic obstructive pulmonary disease, COPD, which is a group of lung diseases that includes chronic bronchitis and emphysema. COPD causes inflammation and damage to your airways and alveoli, which are the tiny sacs in your lungs where gas exchange occurs. The main cause of COPD is smoking, but other factors such as air pollution, occupational exposure, or genetic disorders can also contribute to it. So, if you have persistent coughing that doesn't go away for 3 to 4 weeks or accompanied with other symptoms, talk with your doctor as soon as possible. Number 8. Unexplained weight loss. Have you been losing weight without trying? Do you notice your clothes getting looser or your belt needing an extra notch? If so, you may have unexplained weight loss, which is a decrease of at least 5% of your body weight in 6 months or less. Unexplained weight loss can be a symptom of many serious conditions, such as cancer, diabetes, thyroid problems, or infections. For example, cancer can cause weight loss by using up your energy, suppressing your appetite, or interfering with your digestion. Diabetes can also cause weight loss by preventing your body from using glucose, which is your main source of fuel. Thyroid problems can also cause weight loss by speeding up your metabolism, which increases your energy expenditure. So, if you have unexplained weight loss that is not due to diet or exercise, see your doctor as soon as possible. Number 9. Changes in vision. Now, we're not talking about needing glasses because you can't see the TV. We're talking about sudden changes like blurred vision, seeing floaters, or even loss of vision. These changes in vision can be subtle and often go unnoticed until they become more severe. For instance, blurred vision could be a sign of refractive errors such as nearsightedness, farsightedness, or astigmatism. Floaters, on the other hand, are usually harmless but could indicate a retinal tear or detachment in rare cases. Sudden loss of vision, on the other hand, is a medical emergency and could be due to serious conditions like glaucoma, macular degeneration, or even a stroke. Regular eye checkups can help detect these conditions early and prevent vision loss. Number 10. Swollen or stiff joints. We all have those days where we feel a bit stiff, especially after a good workout. But if you're noticing swelling or stiffness that doesn't go away, it could be a sign of arthritis or another joint condition. Arthritis is an inflammation of the joints that can cause pain and stiffness and can affect any joint in the body. There are different types of arthritis, including osteoarthritis, rheumatoid arthritis, and gout, each with its own causes and treatments. So, if you're experiencing persistent joint pain or stiffness, it's important to see a doctor for a proper diagnosis and treatment plan. Number 11, constipation. Constipation is a common condition that affects people of all ages. It can be caused by a variety of factors, including a lack of fiber in the diet, not drinking enough water, a lack of physical activity, certain medications, and stress. However, chronic constipation could be a sign of more serious health issues, such as bowel obstruction or colon cancer. If you're experiencing chronic constipation that doesn't go away, it's important to talk to your doctor. They can help determine the exact cause. Number 12, frequent fatigue. Feeling tired all the time? It could be more than just lack of sleep. Chronic fatigue can be a sign of a number of health issues, including anemia, thyroid problems, heart disease, diabetes, and sleep disorders. Anemia causes fatigue because it reduces the amount of oxygen that your red blood cells can carry to your tissues. Also, if your thyroid is underactive, known as hypothyroidism, your metabolism slows down and you feel sluggish. Fatigue can also be a symptom of mental health issues like depression and anxiety. That's because depression can affect your mood, motivation, and brain chemicals that regulate energy levels. So, if you have fatigue that lasts for more than 2 weeks, it's important to talk to your doctor. Number 13, dizziness. Dizziness can be a sign of a lot of different things, from dehydration to a serious infection. For example, it can be caused by inner ear problems. Your inner ear helps you sense motion and keep your balance. If something goes wrong with it, such as an infection, inflammation, or injury, you may experience vertigo, which is a type of dizziness that makes you feel like you or your surroundings are moving. It also can be caused by anemia. If you have anemia, your tissues and organs may not get enough oxygen, which can make you feel weak, tired, or dizzy. Other than that, if your blood pressure drops too low, your brain may not get enough blood and oxygen, which can make you feel lightheaded or dizzy. So, if you experience frequent or severe dizziness, see your doctor. Number 14, excessive thirst. It's normal to be thirsty, especially if you've been working out or it's a hot day. But if you're finding yourself constantly thirsty, even when you're drinking plenty of fluids, it could be a sign of diabetes. Diabetes can make your blood sugar levels too high, which makes you pee more often and lose water. Another possible cause of excessive thirst is diabetes insipidus, which is a rare disorder that affects how your kidneys balance fluids in your body. Diabetes insipidus can make you produce too much urine, which can also make you dehydrated and thirsty. So, these were the 14 health symptoms that men should never ignore. Remember, your health is very important and you deserve to be well. Don't let fear, embarrassment, or denial stop you from seeking help when you need it. The sooner you get diagnosed and treated, the better your chances of recovery and prevention of complications. So, if you notice any of these symptoms or any other unusual changes in your body, don't hesitate to consult your doctor. It could save your life. Now, we want to hear from you. Do you have some of these signs? Were they actually indicating something serious? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.